Hello, everyone. My name is Kayla Robinson. I am one of the health sciences librarians here at the Medical Center Library. And today we're going to have the first video in our series of videos on researching health disparity topics. So today we're going to be working primarily in PubMed and talking about how to develop a health disparity topic, and most importantly, how to develop a searchable health disparity topic. In my experience, a lot of people start either very broad or very narrow when they're going to develop a topic. And I'm going to show you all the pitfalls and ways to work around doing this. So obviously we're here in PubMed. Let's talk about refining a broad topic first. I have an example prepared. So we're going to talk about transportation and access to health. So if you're looking at articles and you want something along the lines of how do people get to primary care appointments? How do people get to hospitals? What kind of transportation do they take? And you want a broader overview, this might be a question that you may ask yourself and then start looking for literature on. Now I have a little search prepared here already. I'm going to copy and paste that over. Rid of that. Okay, so this video is not teaching how to search using syntax. So if you're unsure what these little brackets are and what these quotes and asterisks mean, we have videos on another guide, which we can link here, that will show you how to build a more advanced search. But for now, let's talk about the terms itself. So our topic is just transportation and access to care. So here I've constructed a search that would accurately reflect that research question. We've started off with transportation mesh or transportation title abstract. We're going to and that with some other mesh terms of health services accessibility. And we have or access to care or healthcare access or access to health. So this is a direct translation of the research question into the database. Going to click my add to history option. And as you can see, we're getting around 6,000-ish results. So what is one of the issues here? Well, the results are fairly large. I've definitely searched larger. And if going through 6,000 articles is no problem for you, I'm not one to stand in your way. However, the topic in the research question here is just a little bit problematic. We don't have a population, right? So who are we looking for? What kinds of transportation? Where are these people living? What health problems do they have? It could be a number of things. So if you look here, we have the public health case for addressing transportation related barriers to care. So this could be a good one. But if we scroll down, this one is based in sub-Saharan Africa. So maybe in your mind, your research question is focusing on Appalachian populations, Kentucky populations, US-based populations. This result set is not going to accurately reflect that because it's too broad. So one of the things that I would like to point out here, though, is that searching and developing health disparity topics is not an easy feat to accomplish. And there's no perfect way to search for these things. We're not talking about systematic review searching. We're just talking about literature review searching, looking for articles for, papers, research articles, things of that nature. So this is an iterative process. This search might not be the first search you conduct, and it's definitely not going to be the last on this topic. So one of the things I like to tell people is that you are more than welcome to go in and kind of play around with your search terms, test things out, see what happens. And that's exactly what searching health disparity topics is in general, even for someone like me who does this kind of thing every single day. So this topic, it needs a little bit more refinement. If I'm a researcher or student, I don't like this number of results. This is not good. I don't have the time to go through these. So let's think about narrowing our topic. Now I said that we were doing broad topic. I'm going to jump immediately into narrow topic. So kind of skipping that middle ground where we'll finish off today. So a narrow topic, kind of in the same vein, is transportation and access to health care in Kentucky. So we want to look at Kentuckians specifically. So once again, I've prepared a separate search. So here we have the same terms, right? Transportation, health services, accessibility, access to care, all of this kind of defines our initial broad topic. But then I've went ahead and added my and so that the articles will also include Kentucky terms. So we have Kentucky, asterisk, truncation here. So we can pull Kentucky, Kentuckians, Kentuckian, or Kentucky mesh. So let's see what this does. Okay, now I like the picture this paints. We went from something pretty broad, it could be more broad, honestly, something to something incredibly narrow. So 6,000 to 14 is a pretty large jump. And what caused that was this Kentucky term. So here we go, from 1977 to current day, we have 14 articles that span 5 decades, I believe, at this point. So this might not be the best article set for you, right? So here's one. It's from 2009, though. So is that the most relevant? I have no idea. I'd have to get in there and read it. But we have, like, as you can see, just a broad range of dates and topics. And some of these, this one's oral health. So if you're not looking at oral health, this one's not going to be relevant. And now you have basically maybe 1-2 articles to work with, when you could have a lot more if you would just refine your research topic, your research question again. So like I said, the population for this specific research question of Kentucky is too narrow. Now for other research questions, searching for Kentucky might not be too narrow, but in this instance it is, and you're not going to know until you test it out. So if you're wanting to look at a population of rural Kentuckians, or even Kentuckians in general, you're going to need to broaden that piece, that population piece. So let's go back. Broadening this population is going to be something we're going to do now, but it's going to be discussed in the next video. And that's the topic of generalizability. So Stephanie, my colleague, is going to be talking about that much more in depth. I'm just going to show you how to get the articles that you can then use to generalize to different populations. So my middle ground, my topic that's a little bit narrow, a little bit broad, it's going to give you a lot more articles to work with, is transportation and access to healthcare in Kentucky/Appalachian region specifically. So if you're looking at rural Kentucky on the eastern side of the state, those Appalachian counties are going to be a little bit more generalizable to other counties in other Appalachian regions. Once again, and finally, I've prepared a search already. So let's get that in here. I haven't changed anything in my other 2 searches, and that's not because there's nothing to change here. There are definitely other terms you could be using to talk about access to health. You could say primary care, you could say hospitalization. You can look at all different aspects of healthcare access in this instance and get similar articles. So once again, I'm going to say this a lot, but this is very much an iterative refining process, and things aren't always going to be right on the first try. With this last search, though, I have only edited my Kentucky piece. So I left Kentucky, but I've added Appalachian region and Appalachia, title and abstract. So let's see what this does, right? Okay. This to me, it still might be a lot to you all, but you can add limiters and things. 311 is a lot, but this to me is a very good set of articles. You're going to have things in here that aren't relevant, but you're going to have so much that could be used for your research article, for your paper, however, you plan on using these results. Naturally, our first one here is access to transportation and healthcare utilization in a rural region. I'm not sure where this rural region is, but this is the Journal of Rural Health, so it's probably, let me say this lightly, in the United States. This one is looking at immigrants in South Carolina. This one's looking at refugee families. So once again, you're not going to have the perfect set of results every time, but that doesn't mean there aren't things that are going to be usable in here. So here's another oral health care option. Now that is kind of just like a little brief foray into refining and researching a health disparity topic. When I was creating these searches, there was a lot more that went into me choosing and selecting these terms, which will be kind of what it looks like when you all take this and try it on your own. The next video is going to be talking about generalizability, as I said. So Stephanie is about to hop on. But if y'all have any questions or want to talk about any of this, please feel free to email me or any of the medical center librarians. We're happy to help. Thank you so much.